Hey y'all, it's Bill. Well, today I'm going to limit my subject just to one thing, and it should not take very long, just a few minutes. A week ago today, I was referred by my primary care physician to a urologist for a complete checkup. My um, labs have been coming back with high PSA levels, and it's been occurring quite frequently, almost annually, when I get my blood work and my annual physical. And so I went to see a urologist 4 or 5 years ago, and didn't seem to be any concern. But this time, uh, the number has gone up, and so my doctor, same doctor, has referred me to a different urologist. And so I went a week ago today, and you know, for those of you guys watching this, you know what a prostate exam is. It is no fun, and the doc really hurt my feelings when he said, "Okay, drop them and bend over the table." Um, you know, uh, most of us that are men, if we've ever had a physical, we've had this done, so it's not a huge deal. Anyway, he didn't notice any enlargement in the prostate. Um, and I'd been having some minor urinary issues. And so he said, well, if your prostate has a blockage in it, it can cause the other problem. And so he said, let's attack it. He said, now, if we attack just the bladder issue, then, we may or may not be able to fix it, or determine the cause of it. He said, but if we attack the prostate end of it, um, if there is a blockage there or a slight enlargement, I can put you on medication that will deal with both of those conditions. And if that's what's causing the bladder problem, then the bladder problem will disappear on its own. And of course, when you get older, we are at a higher risk. Those of us that are men are at a much higher risk the older we get of developing prostate cancer. So that becomes a very big deal um, whenever you go to see a urologist and you're, my age, I'm 69. And so that's what he did. So I got my medication in the mail about 4 days ago, 3 days ago, it arrived. So I started taking it. Today is my third day, and I'm already noticing just a slight improvement in my bladder function. What was happening is when I would go to the bathroom and urinate, when I would finish, it always seemed like there was, I hadn't completely emptied my bladder. And so if I waited just a few seconds, 15, 20 seconds, 30 seconds, then, there, the stream would reappear, and then I would finally feel like I had emptied my bladder. And so this has been happening for months and months now. And I told him about that. And so, of course, nobody wants to wear diapers, do they? I mean, you can't go out in public and then all of a sudden have an urgent need to go to the bathroom and not be able to hold it for at least a reasonable period of time until you can get to a restroom. So that's kind of what's been going on. It's just a kind of an isolated thing, but one of those things where, you deal with it now, you get it checked. Hopefully the levels will come back into the normal range. If there is a blockage there or slight enlargement, this medicine should take care of it. Now I'll try to pronounce the name of the medication. Tamsulosin. I don't know if that's pronounced Tamsulosin. And I'm taking 0.4 milligrams It's a capsule that you take once a day by mouth. So that's what I'm taking. Hopefully this will take care of it. And I'm going to stop right here and say bye for now. Y'all take care. I appreciate all of you. Thank you so much.